Hello everyone, my name is Nupur Goyal and I'm a basic physician trainee at Eastern Health. Today I'd like to present my research I've conducted with Dr. Lyn-Li regarding urine testing and antibiotic prescribing in a geriatric inpatient setting. To start with a bit of background, diagnosing urinary tract infections in older adults, especially over the age of 65, is recognised as being complex, with an estimated 10 to 40% of cases being incorrectly diagnosed. This is due to a number of factors, some of which include cognitive deficits impairing communication of symptoms, as well as the presence of chronic genitourinary symptoms. Urine testing, which includes both dipstick and cultures, cannot differentiate between asymptomatic bacteriuria and urine tract infection. Inappropriate urinalysis testing practices in nursing home settings are shown to contribute to type 1 errors, which includes both overdiagnosis of urinary tract infections and subsequently overprescription of antibiotics. More studies are needed to evaluate practices in a hospital setting. This becomes important because literature shows that elderly population are at an increased risk of carrying multi-resistant extended beta-lactamase producing bacteria, where exposure to antibiotics is a contributory factor. With this study, our aim was to assess current practices of urine testing and antibiotic prescribing in a geriatric inpatient setting. The intended benefits included identification of common reasons prompting urine dipstick testing, identification of reasons prompting urine culture testing, assessing the appropriateness of urine testing in current practices, and identification of any opportunities for optimizing current practices surrounding urine testing and antibiotic prescribing. We conducted a 1-month audit of all patients admitted to a subacute geriatric ward at Eastern Health, and we reviewed all urinalysis and urine cultures performed over this time. The appropriateness of urine testing was assessed based on McGeer criteria, which has been used as a surrogate measure of appropriateness in an aged care home setting. And the appropriateness of antibiotic prescribing was assessed based on therapeutic guidelines antibiotics. Going through our results, we'll look at the urinalysis results first, and we found that 66% of patients had inappropriate testing of urinalysis based on the McGeer criteria. And the most common reason for inappropriate urinalysis was actually routine testing on admission of asymptomatic patients. Looking at the urine cultures, 24% of patients had inappropriate testing of urine cultures. And very interestingly, there were similar levels of inappropriateness in those who had urine testing done when not clinically indicated, and those who did not have testing even though it was clinically indicated. And 27% of urine cultures were tested directly due to abnormalities detected on urinalysis of asymptomatic patients. Looking at this in a flowchart, of the 41 patients we assessed, more than half of the testing was done on asymptomatic patients as part of a routine testing on admission. And again, I'm just highlighting the fact that on one hand, there were cultures inappropriately performed on asymptomatic patients, while on the other hand, there were cultures inappropriately not performed on symptomatic patients, showing a lot of discrepancy between the reasons for initiating testing in the first place. And subsequently, 17% were prescribed antibiotics, of which none met the McGeer criteria. Our key findings showed that performing urinalysis in asymptomatic patients is not useful and can contribute to unnecessary urine culture testing. We found that urine culture testing was not routine in patients with symptoms, identifying discrepancies with reasons for testing. Antibiotics were just as likely to be prescribed for symptomatic patients, irrespective of whether a urine culture was performed or what the culture results were, again highlighting that urine testing was not necessarily guiding management in these patients. So this study has identified potential areas for enhanced education, which are twofold. One, nursing stewardship of urine testing regarding initiating and interpreting urinalysis results, and two, medical stewardship regarding initiating of urine culture testing and antibiotic prescribing. And we're starting to do a bit more research addressing these two areas. Thank you for listening in, and I'll see you at the conference.